Okay, welcome back everyone. Today we're going to talk about the types of body movements. And so there's going to be a little bit more information in the chapter itself that I'm not going to exactly cover in this video, but I think this video will be a good look at everything overall and definitely be a big support for you in reading the chapter. So first thing I want to say is that synovial joints are going to allow for a huge range of motion. And we have already talked about that, right? Those synovial joints are the freely moving joints. Each movement at a synovial joint results from the contraction or relaxation of the muscles that are attached to the bones on either side of the articulation, or either side of the joint. Um, the type of joint results in the type of movement produced. So depending on what type of joint we're talking about, we already talked about that it restricts the type of movement that can be produced. Movement types, what you're about to see, are generally paired, where one will be the direct opposite of the other. And body movements are always going to be described in relation to the anatomical position of the body. If you remember from earlier on in this course, we said the anatomical position of the body is an upright stance with the upper limbs to the side of the body and palms facing forward. So just think about you standing up normally with your feet on the ground and then just twisting your arms so that your hands or the palms would be facing forward. And the next thing I want to do before we get into the type of movements is talk about anatomical planes, just to remind yourself and do a refresher, because we will mention them when we talk about the body movements. So the coronal plane, or the frontal plane, is the plane that might divide the body into front and back sections. So if you could imagine sort of slicing the body directly from the top of the head down in that red, you see that red box here, in that area, that is what the coronal plane is. The sagittal plane divides the body in the opposite way, so there's left and right sections, and the median line would divide the body directly into equal left and right parts. And then the axial or horizontal or transverse plane divides the body into upper and lower segments. And so with that, let's get into the first combination of movements, flexion and extension. Flexion and extension are typically movements that take place within the sagittal plane, and they involve anterior or posterior movements of the neck, the trunk, or the limbs. When you think about the vertebral column, flexion is a forward bending of your neck or the trunk, and extension involves a posterior directed motion or just coming back from a bent over position. That would be flexion. Lateral flexion is defined as the bending of the neck or trunk toward the right or the left side, okay? So when we think about the vertebral column, flexion is forward bending. If you're bending down in front of you, that's flexion. When you come back up, or even if you lean backwards, that is extension. And then lateral flexion is bending to the left or the right. When we talk about the limbs, flexion decreases the angle between the bones, which is just bending the joint, while extension increases the angle and straightens the joint. So think about putting your arm directly in front of you with the palm facing up. It's fully extended, but when you flex, it decreases that angle and it bends the joint. Okay? When we talk about things like hyperextension, like, oh, I hyperextended my leg when I was playing volleyball. Hyperextension is an abnormal or excessive amount of extension of a joint beyond its normal range of motion, and thus you'll result in an injury. And so that was flexion and extension. And similarly, hyperflexion is excessive flexion. So you can go hyperextended, you can hyperflex as well. Here's just a good anatomical view of what we are just talking about, of flexion and extension. You can do it. Not pictured here, but you could bend your entire torso to flex and then backwards to extend as well. Okay, so let's talk about abduction and adduction. Abduction and adduction motions occur within the coronal plane. If you remember, we just talked about what the coronal plane looks like, and they involve medial and lateral motions of the limbs, fingers, toes, or thumb. So if you take a look, this guy right here is just moving his arms up and down, right on that coronal plane. Abduction moves the limb laterally away from the midline of the body, while adduction is the opposing movement that brings the limb toward the body or across the midline. And so we can do that with our fingers, we can do that with our toes, and we can also do that with our thumb. But this is just showing the entire limbs. Okay, the next one is circumduction. Circumduction is the movement of a body region in a circular manner, in which one end of the body region being moved stays relatively stationary while the other describes a circle, and you can do that with your arm, where you can make a full circle with your arm, and you know that one end, which is basically where your arm is attached to your shoulder, stays relatively stationary, and then your hand end, the end of your fingertips, is basically making a circle in midair. So that's called circumduction. The next one I want to talk about is rotation. And we can do rotation at a number of points. It can occur in the vertebral column, at a pivot joint, or at a ball and socket joint like your hip or your shoulder. Rotation of the neck or body is the twisting movement produced by the summation of small rotational movements that are available between adjacent vertebrae. Movement that brings the anterior surface of the limb toward the midline of the body is called medial, or internal rotation, and the other opposite is rotation of the limb so that the anterior surface moves away from the midline. It's lateral. And so if you look here, this guy, if he's going from taking his left leg and moving it left, we call that lateral rotation because it's moving away moving away from the midline. And then if he's moving it the opposite way, we call it medial rotation because it's moving toward the midline of the body. Okay. The next one is supination and pronation. Supination and pronation are movements of the forearm. And when we're looking at the anatomical position, remember the anatomical position is arms down at your side, palms facing forward. The upper limb is held next to the body with the palm facing forward. That is supinated position of the forearm. Okay? And then if we go to the opposite, where we are maybe how you normally stand with your palms facing backwards, that is called the pronated position. In a supinated position, the radius and ulna are parallel to each other. And then the pronated position, the radius and ulna actually form an X shape. And so that's just an interesting thing to think about when you have talked about the bones in a little bit of the previous chapters. But this is supination and pronation, is just the movement of the forearm. Okay, the next is dorsiflexion and plantar flexion, which are movements at the ankle joint, which is a hinge joint. If you lift the front of the foot so that the top of the foot moves toward the anterior leg, that's dorsiflexion, so that's right here, lifting the foot. And if you lift the heel this way, or even just moving down with your toes that way, that is plantar flexion. Okay. The next is inversion and eversion. Inversion is the turning of the foot to angle the bottom of the foot toward the midline, while eversion turns the bottom of the foot away from the midline. And actually, you can try it yourself. The foot has a greater range of inversion than eversion. So it's much easier to do this motion than it is this motion. Try it yourself, and most of us can probably get almost like a 90-degree turn here, but we can't go much farther than what this foot is doing right here. Okay, so let's keep moving. Okay, protraction and retraction can happen in two different areas, either movements of the scapula or movements of the mandible. Protraction of the scapula occurs when the shoulder is moved forward, like when you're pushing against something or you're throwing something. Retraction is the opposite motion, with the scapula being pulled posteriorly and medially towards the vertebral column. For the mandible, protraction occurs when the lower jaw is pushed forward to stick out the chin, and retraction pulls the lower jaw back. So here's protraction, like when you're pushing something or throwing a ball. Retraction, when you're pulling that scapula back. Protraction is when you're pushing the jaw out, and retraction is you're pulling the jaw in. That's kind of a funny picture. I just had to put it in here. The next is depression and elevation. Depression and elevation are downward and upward movements of the scapula or the mandible. So we just like we talked about in the last one, this is also can be done in both the scapula and the mandible. So when you have the upward movement of a scapula, like in this picture right here, that's called elevation, and a downward movement is called depression. These movements are used to shrug your shoulders, right? Oh, I don't know, shrug your shoulders. Similarly, elevation of the mandible is the upward movement of the lower jaw used to close the mouth or bite down on something, right? Here goes elevation. And depression is the downward movement that produces the opening of the mouth. Okay. Another one is called excursion, and this is only a movement of the mandible, and it's the side-to-side movement of the mandible. Lateral excursion moves the mandible away from the midline, so either the right or left. This is lateral, and if you went this way, it would be lateral. And then medial is just returning back to the resting position. So that one's pretty simple. And then we'll talk about superior and inferior rotation. Superior and inferior rotations are movements of the scapula and are defined by the direction of the movement of the glenoid cavity. During superior rotation, the glenoid cavity moves upward as the medial end of the scapular spine moves downward. Superior rotation of the scapula is thus required for full abduction of the upper limb. So you have to do superior rotation of the scapula if you want to move your arms upward. This is actually a really important movement because without it, we would not be able to fully reach our arm up that high. So you can actually feel this rotation if you picked up a heavy load, such like as your book bag, or if you're going on a trip, you pack your bags, and you try to carry it on your shoulder. You'll notice that let's say you're picking it up with your right arm and putting it over your shoulder. You will feel that in order to increase the weight-bearing support, that shoulder lifts, and the scapula will superiorly rotate. And then in the opposite direction, inferior rotation occurs during limb abduction, and it involves the downward motion of the glenoid cavity with upward movement of the medial end of the scapular spine. So if you were to reach down and to get something, what has to happen here is that they have to have downward motion of that glenoid cavity and an upward movement of that medial end. Okay, you can see that right here. Okay, the next set that I want to talk about are opposition and reposition. Opposition is a thumb movement that brings the tip of the thumb in contact with the tip of the finger, so you can do that. One of the things that they always ask you to do in sobriety tests, right, is touch each of the tips of your fingers to the tip of your thumb. That's called opposition. Thumb opposition is produced from a combination of flexion and abduction of the thumb at its joint. Returning the thumb to its anatomical regular position, the resting position, that's called reposition. And with that, we've gone through all of them. Thanks for joining me for this video. I'll look forward to seeing you in the next video. Thanks.